this is of course Dr. RAKSHA Rao, and RAKSHA is consultant orbit oculoplasty and ocular oncology at Narayan Nethralaya, Bangalore. So RAKSHA was the winner of 2016. So over to RAKSHA. RAKSHA, even with oculoplasty, you have won the CS RESHMI. So subspecialty, absolutely no bar.
Thank you, sir. Thank you for that introduction. Okay, so I'm going to be sharing my screen now. Okay, so I'm going to be playing this video. This is the video that won the CS RESHMI Award in 2016 Kolkata.
No sound, RAKSHA. Sound is not there.
RAKSHA, can you check on the sound?
Is there no sound?
No sound.
Not audible.
RAKSHA, do you want to, just play it once again?
Yeah, I'll just do that. Maybe I can just play direct from the file instead of.
You have the video in your laptop, then I think play it directly.
Is the sound there now?
No,
no, it is not there. You have to stop sharing. You have to stop sharing, Dr. RAKSHA.
Okay.
And then when you share, there is an option of share sound and optimize your audio clip. Click on that and then click on screen 1. So whatever is there on the screen, it will get displayed. Try it, please.
Okay, I just have one option, share screen.
And when you share screen, do you see any 2 check marks on your bottom?
Unfortunately, no. No, it's just one option, share.
When you click share,
okay, yeah, share sound and
okay,
up. Yeah. I think I got it.
Open up.
Yeah, share.
Tumor of the left orbit in a 39-year-old patient.
Is this better?
Yes.
Okay.
RAKSHA, it's fine.
Perfect.
Inferior rectus muscle is stacked with fluorosil suture. Lateral canthotomy and inferior cantholysis are done to provide improved exposure of the orbit. 3 fluorosil traction sutures are passed through the lower eyelid for traction during the surgery. A formational conjunctival incision is made immediately below the inferior border of the tarsus, beginning just below and lateral to the punctum and extending to the lateral canthus. A plane of dissection is created anterior to the orbital septum after incising the orbicularis. Dissection is continued posterior to the muscle while recessing the septum to approach the inferior orbital margin. Periostal incision is made immediately below the inferior orbital rim and relaxing incisions given at either end, perpendicular to the horizontal incision. The periosteum is separated from the bone and subperiosteal orbital space is approached. Dissection is limited so as to not damage the infraorbital nerve and the inferior orbital fissure contents. After adequate separation, an incision is made in the periosteum to enter the intraconal space, causing fat prolapse. Fat is gently separated to locate the intraconal tumor, in our case, a cavernous hemangioma. Cryoprobe assisted delivery of the tumor is done with gentle separation of any adherent tissue around the lesion. Hemostasis is achieved and conjunctiva closed with interrupted sutures with sixovicryl without suturing the periosteum. Lateral canthotomy is repaired with sixovicryl suture. Minimally invasive and safe approach to extra and intraconal orbital tumors. Our patient had a quick post-operative recovery with good cosmesis.
So that was the video. Am I still audible?
Yes,
You
yes,
are,
very much.
Raksha.
Yeah. Okay. So this is another. This is the presentation that I'm sharing. Is this visible?
Uh,
No. Is this your PPT, Raksha?
Yeah, it is.
Stop sharing. Please stop sharing and then start sharing it again. Yeah, now
Okay.
it's coming. Now it will come.
Okay. Okay. So this video, there was really nothing, no research question as such, but we thought that oculoplasty and oncology videos and
The
basic
PowerPoint is
surgery
not clear.
no,
I think there is a
it's fine now.
Now, now it's
Okay.
better.
It's okay. Okay.
Getting better.
So we did this video when I was a fellow with Dr. Honawa, and we decided that we need to get the orbital surgeries to the fore.
Raksha, sorry to interrupt. Do you want to put
Yeah.
it in the presentation mode?
Yeah, this is in the presentation mode.
No, it is
No,
not.
it isn't. Now it is. Just wait for a second. Yeah, now it's clear.
Okay.
Carry on.
Okay, so this video was made during my fellowship with Dr. Honawa, and we decided that we need to bring the orbital surgeries and oncology part of ophthalmology to the fore. So this is how the concept of getting this video done came to the fore. But what I would like to add at this point is not everyone can bring absolutely new procedures every year and absolutely unique procedures every year. But what we can do is with existing procedures, we can present it differently, and that is what a synopsis must contain, that the way we describe the surgery. So what we did in this 8-minute long video, which was obviously not shown here, is that we demonstrated through animation the orbital anatomy, with which one could obviously learn the orbital anatomy and do surgeries. So when we do videos, I think what we must give importance to is that it should be extremely specific, meaningful and accurate, and definitely relevant to as a teaching point. And one must definitely not forget that we should be time bound while presenting in an award session. So most of these points Dr. Nishant has covered. Basically, about oculoplasty and orbit surgeries, we don't do these surgeries under a microscope. So recording with an external camera, one must know the nuances, because the surgical field is quite big, and there is a different focusing length each time, because at the beginning you are at the conjunctival level, and as you approach the mid-orbit, the posterior orbit, the focus is different. So one must definitely know the nuances while recording orbital surgeries. Then, like Dr. Nishikant sir has covered, clarity, centration, good cropping, crisp editing, and a very good script that goes on in the background with the good background music, which is of correct volume. All these are important. And like what we used in this video, we have used animations to demonstrate anatomy and certain steps which may not be clearly visible in the surgical video. You can definitely use animation for that. And what can create an impact is probably the before and after images of a surgical patient, the pre-op and the post-op images. So at this point, I also have to share an anecdote. Like I mentioned, this video was done while I was a fellow with Dr. Honawa, and this is embarrassing to admit that I had no idea what a CS RESHMI award was. So Dr. Honawa was very excited when the video that we made was selected for the CS RESHMI award, and he appeared very excited, and I was like, okay. And I was supposed to be at the US the next month for my 1-year fellowship, and I had no ideas of no plans of coming back for AIOS to present just the video. So then Dr. Honawa sat me down and he explained to me what a coveted award this is, and he said that he had attempted for this CS RESHMI award about 10 times previously since the time of his residency, and that made me realize that this is something to really look forward to. And he made me book tickets from US for the conference that very day, and I Of course, I came from the US for the conference, and I won not only the CS RESHMI award that year, but also Best Paper in Oculoplasty Sujata Savitri award. So what I mean to say is this award should be dedicated to all those teachers who push their students much beyond their capabilities, especially someone like Dr. Honavar. And also at this point, I would like to add that I have a small regret that the CS RESHMI award that I won was not a surgery that I performed myself. But of course, I have contributed greatly to the script, to editing, voiceover, submission, presentation, and finally, of course, the presentation at the conference itself. So my take-home message would be that, one must really aspire to get an award, must contribute significantly to feel happy about receiving the award. And at this point, I stand humbled to have received this award so early in my career. And definitely, I would like to present my own videos sometime, and hopefully to get in the top 15 again. Thank you.
Thank you very much, Raksha, and thank you for your anecdotes. It's a treat, and the mentor is so powerful that he leads the way and you lead in front of him. So over to Dr. Usha and Paruz for your comments.
Thank you, Dr. Partha, and Raksha, once again, hearty congratulations on winning.
Thank you, Paruz.
And we all know, Dr. Partha has already said that, subspecialty, it's not easy for a very niche subspecialty to sneak in and win an award. It's a big, big thing. We have the right person over here, Dr. Usha, whom most of the time in any of her presentations, there is not a single presentation that we have seen of Dr. Usha where she has not showed at least a minimum of 5 videos, even in a 10 minutes or 15 minutes presentation of oculoplasty. And that is the impact and learning that we get from videos. And she is the best and the right person to take the discussion on, how to make an oculoplasty videos for the aspiring CS RESHMI awardees. Over to you, ma'am, and welcome.
Thank you, Feiruz. I think I don't deserve that kind of an introduction, but anyway, I'll take that. And thanks, Dr. Partha. This is an excellent session where I should say I'm learning a lot, in fact. Now, I have something to ask you. Which genre do we fit in? You said anterior, posterior, and general. Where do we fit this in?
So this was submitted under general film.
Yeah, please make a space for us.
Yeah, we're always in the general.
Yeah, we encompass the entire anterior, posterior, everything, but we still don't get space. All right. Despite that, Raksha, you've done an excellent job and won this award. So I think the most important thing here is, I think we are contrary to the rest of the presentations in one sense that it is a very complex surgery made very simple. So Raksha, from that video, it looks like anybody can do the surgery.
Yes,
even vitreoretinal surgeons could do that surgery now. So that's how I would view it, in fact. And the most important thing is, whatever you intended that the viewers should learn was the content of your video. That's just the right thing. That's what made it very special. Probably it's very important for us to make the viewers understand that it is not difficult. Anybody can adopt and adapt, and you can perform the surgery, provided you follow this meticulous, going through the anatomy, which is very important, and following the steps of the surgery, which was very well highlighted. So that's probably one of the reasons why you had a special space, despite all the leading retina, cornea, glaucoma, cataract specialists competing for the special award. And I think what you mentioned was very, very important. The images make an impact. Like having such a big tumor out and seeing the postoperative image without any, blemish on the face is what is very powerful message. And one thing we have to remember, especially as oculoplasty people, is if something happens for the rest of the people, glaucoma, retina, or cataract, only the person will know that she or he cannot see. Whereas when our patients walk around, the world can see the mistakes. So it's very, very important that we show the impact of our surgery so very well, put forward. And that was very, very important message that you had conveyed. And the procedure you chose, it's a very user-friendly. And you didn't have to have, exotic machines or navigation systems to project at this particular procedure. So all of these, I think, has made it very powerful and made you win this award. So let's make our videos informative, innovative, and let's allow our viewers to understand that it's going to be a simple procedure provided you follow a protocol. And it's very, very important that we show our videos. So again, I would like to vary a little bit on the presentation, publications. One, yes, you have to publish your material. But what's even more important is, see, when you read a book, especially the ones written by the authors outside of India, the language is not very easy. It's not conducive for everybody to follow. But a video, when shown with all the steps, is very easy for anybody to replicate. And after all, it's the procedure that needs to be adapted by the surgeons. So I think it's very important that videos are mandatory for teaching. Thank you. Thank you, Partha sir, and the rest of the AIOS team for giving us this wonderful opportunity. And make sure that you please include another genre, please. This is a humble request.
Ma'am, I think
Thank you,
we'll come up
Dr.
with the
Usha.
guidelines, which specialty falls in anterior segment, posterior segment. We just discussed this few days back. So very soon the guidelines will be released.
Thank you very much, Dr. Usha.
Thank you, everyone.
Yeah, I'll just put in few words here. In the
Yeah.
same line Dr. Usha has said, in fact, when you're recording, it's not too difficult to record a video in a microscope because, it's there and you're recording every video. But when it comes to oculoplasty, and I'm sure all the residents, fellows, and even consultants, we have a lot of difficulties in focusing, keeping a camera right there because the field of view, which Raksha has already mentioned, it's slightly different, and it's almost, most of the time there is lot of blood around. And of course, Dr. Honavar is obviously a bloodless surgeon, but not all of us are. So I'm sure Raksha would have really worked on it to, capture the most step and the cuts, which is like very clear, avoiding even one single drop of blood. Did you do that, Raksha?
No, unfortunately for me, this was a very bloodless surgery. But I'm sure the anesthetists were having a bad time maintaining a hypoanesthesia blood pressures.
Yeah. So there are certain, very precise things that has to be looked into. And of course, Raksha's voiceover was excellent. How did you record it, Raksha?
So this was at a recording studio.
All right. Yeah. So people take so much of an effort when they, going for a competitive sessions. They even go to a recording studio to record their voiceover, or, sometimes even in, I know LV Prasad has a recording studio in the institute itself. So there is a lot of effort even in the tiniest of the intricacies in making a video. So, and of course the effort is one. So thank you very, very much, Raksha, and
Thank you, Feroz.
Thank you, Feroz.
I also have to add one more line here. See, it's not easy for people who turn presbyopic to record under the microscope. It's very, very difficult. So people have shifted from wearing glasses to wearing contact lens to record. So that's the effort that is being put in from a lot of surgeons.
Yeah.
Thank you.
Thank you.